If your nights are ruined by constant peeing, listen, I'll give you great tips that even doctors won't tell you. I will show you how you can use food just like medicine to shrink and enlarge prostate. Stay till the end for the last tip. It's the one people miss and it's surgical level powerful. So, what are we going to cover in this video? We are going to cover what is prostate enlargement and what are those symptoms that we are trying to avoid. Then I'm going to talk to you about the medications that are commonly prescribed for prostate enlargement and how we can recreate those same effects using food or supplementation. I'll give you the data to show you how powerful food and supplements can be for shrinking and enlarged prostate. And then I'll give you a specific tips for how you can put this into use in your own life in order to get the results that I'm going to share with you today. So let's start with what is prostate enlargement or benign prostatic hypertrophy or BPH. Well, let's start with what is the prostate. The prostate is a gland about the size of a walnut that sits right below the bladder and it wraps around the urethra. And the urethra is the tube that takes the urine from the bladder outside the body. Now, as that prostate enlarges as we get older, it can put pressure on that urethra and cause a lot of uncomfortable symptoms. Now, prostate enlargement is really common. It doesn't generally impact anyone below the age of 40. About 8% of men in their 40s will get prostate enlargement, and over 50% of men over the age of 50 will have symptoms of prostate enlargement. And by the time we reach the age of 80% of us will have some symptoms of prostate enlargement. So it's super common and it is one of those conditions that almost all men are going to end up taking medication for at some point in their life. Now, prostate enlargement can cause some really uncomfortable symptoms. These include urination, getting up multiple times at night or multiple times during the day to go urinate, incomplete emptying, that feeling like I've emptied my bladder but I got to go again, or the urgency, I feel like I got to go again pretty quickly because I still have a urine left in the bladder. Weak stream, dribbling after urination, or difficulty starting or stopping the urine stream are all the symptoms of prostate enlargement. Now, why do we get that prostate enlargement? It's largely because of the cumulative effect of testosterone on the prostate gland. We have an enzyme called 5-alpha reductase that takes testosterone and converts it into metabolite dihydrotestosterone, and that dihydrotestosterone causes proliferation of smooth muscle cells and epithelial cell that gradually causes that gland to increase. When we look at the medications that are prescribed for prostate enlargement, they fall into two major categories. One is the alpha blockers, and that medications like Flomax, which is probably in my practice the most commonly prescribed medication for prostate enlargement. Now, the other class of medications are the 5-alpha reductase inhibitors, and this makes sense because if we can stop the conversion of testosterone into dihydrotestosterone by blocking the effects of 5-alpha reductase, we can stop that gland from enlarging. And the second most commonly prescribed class of medications for prostate enlargement are the 5-alpha reductase inhibitors like PRAR and Evadar And believe it or not, we can replicate the impact of these medications, the 5 alpha reductase inhibitors, using food or supplementation. And the data that I am going to show you is going to blow your mind in terms of how powerful food and supplements can be for shrinking an enlarged prostate, for elevating the symptoms of prostate enlargement, for lowering your PSA levels, and even for reducing the risk of prostate cancer. So, what is this powerful nutrient that can have this amazing effect of blocking the alpha reductase and improving the symptoms of prostate enlargement? This is lycopene. Lycopene not only does inhibit the conversion of testosterone to dehydrotestosterone, one by blocking the 5 alpha reductase, it also inhibits oxygenase, which is an inflammatory mediator. So you are getting an incredible double inhibiting inflammation and reducing conversion of testosterone, so that you get a powerful combined effect to shrink down that prostate. And what is lycopene? Lycopene is a red pigment found in a lot of foods, and it is similar to vitamin A, but it's not actually a vitamin A class of compounds. It is largely classified as an antioxidant, but it is also mentioned as anti-inflammatory properties. And after it's ingested by supplementation or in the diet, it gets concentrated in certain organs, including most notably the prostate, where we get this amazing effect. Now, being a red pigment, lycopene can be found in a lot of red or pink colored fruits and vegetables, including strawberries, watermelon, papaya, guava, pink grapefruit, and the number one food for shrinking prostate, which is, I am sure you've guessed it by now, tomatoes. Tomatoes are the single most important constituent of your diet that you need to be thinking about getting on a regular basis. If you want to prevent prostate enlargement, elevate the symptoms of prostate enlargement, and even prevent your risk of prostate cancer, so let's take a quick look at the data. I'll show you how powerful this can be. So first off, let's look at your risk of actually getting prostate enlargement. And right here we see that you get a 21% reduction in your risk of getting prostate enlargement if you fall into the highest categories of lycopene and tomato intake. And in this trial, what we saw was that it took about 14 milligrams of lycopene daily to put you in the top category. And I'm going to show you later on that's pretty easy to get either from food or supplementation. But now let's look at if you actually have symptoms of BPH, if you already have prostate enlargement, what kind of reduction in symptoms can you get? And this is where the data gets really compelling, because if we look at quality of life scores and symptom scores, what you see is that supplementation with lycopene can get you up to 44% reduction in your symptoms of prostate enlargement. Now that looks pretty compelling, but it's even more compelling when we compare it to the data on drugs that inhibit the conversion of testosterone into dehydrotestosterone. In the study of finasteride, which is a potent inhibitor of the 5 alpha reductase, and it is a prescription medication called PRAN, what we saw was a 23% reduction in the symptoms of BPH using similar patient population and a similar scoring methodology. So what you see is that you are getting probably even more improvement in symptoms
from Lycopene.
that you are getting from prescription medication, and that's pretty cool stuff. Let's look at another key indication of the efficiency of lycopene in treating prostate enlargement, and this is post residual volume. Now post residual volume is the amount of urine left in the bladder after you void if you got an obstruction where that prostate is blocking up the urethra. What we expect to see is a lot of urine left over in the bladder after we urinate, and behold, when we treat patients with lopine as a pure supplement, what we see is a 48% reduction in that post residual volume. So another key metric to look at
In terms of
prostate health is the level of prostate specific antigen or PSA, and when we look at PSA levels, lopine can have a significant reduction in PSA levels. In this study, we saw a 25% reduction in PSA level with patients that took lycopene supplement, and that's pretty significant because PSA levels tend to correlate with prostate volume, and they are also an early indicator for prostate cancer. Now,
this was a study of Lycopene.
supplementation, and what's really interesting is that we compare this data to patient that took tomato paste. This is 3 tablespoons of tomato paste every day for 10 weeks, and we saw an 11% reduction in PSA. So whether we are getting the lycopene from tomatoes
or Lycopene supplementation,
we are seeing pretty substantial reduction, an important measure of prostate health. Now, you might say, if PSA is an indicator for prostate cancer, if it is an early test for prostate cancer, and we are getting a reduction in PSA, are we also getting a lower risk of prostate cancer? And the answer is yes. The data supports that we can get up to 83% reduction in the risk of prostate cancer. And in this case, we are looking at patients who had the highest levels of lycopene in their bloodstream relative to those who had the lowest levels of lycopene in the bloodstream. We saw an 83% reduction in the risk of prostate cancer for the patients who had the highest lycopene in their bloodstream. And in another study that I really found compelling was we compared the risk of prostate cancer in patients who had tomato sauce, just tomato sauce, like what you put on spaghetti twice a week versus less than once a month. And really compelling, you saw over a 20% reduction in the risk of prostate cancer just from having tomato sauce more often than not. So overall, what we are seeing is some really compelling data showing that not only are you getting a lower risk of getting prostate enlargement, but if you have prostate enlargement, it's pretty clear that you can see a significant reduction in symptoms, a reduction in post-void residual, which is correlate with the symptoms. You can see lowering of your PSA levels and substantial reduction in the risk of prostate cancer, all from adding tomatoes or lycopene to your diet. Really compelling stuff. So, how much lycopene do you need to be getting each day in order to see these kinds of benefits? Well, if you want to be among those who get the most lycopene in these trials, you have to be hitting at least 9 to 14 milligrams a day, and that would put you into the highest intake categories where we saw the most benefit in the dietary trials, now most supplements will have up to 50 to 60 milligrams per capsule. And if we look at some of the intervention data that I presented earlier, you see that the high
dose of lycopene
is what we were using to replicate the effect of drugs, and that was up
to 500 mg of lycopene.
twice a day. And there are some supplements, I'll leave some link in the description where you can get that kind of potency, but
It's not run-of-the-mill supplement
that you're going to find in most marketplace. So let's see how are we going to get
that much lycopene
in our diet. Well, there are some representative data, and of course these numbers vary when you search online, because not every tomato is made the same, right? So not every tomato sauce or tomato paste is made the same, but this gives you some general guidance on how much tomato or tomato products you would need in order to get that 14 mg of lycopene daily. And that could be about half a cup of tomato sauce, it could be about 3 tablespoons of tomato paste, or it could be a few medium sized tomatoes. So these are a couple of options, and it gives you some representative metrics. I'll leave the data in the description so you can so that you can use it as a reference. But let's say you didn't want to take a
lycopene supplement.
You didn't want to take a bunch of tomatoes in your diet. You said tomatoes aren't my thing,
Where else can I get lycopene?
and there's really a few other fruits that are pink or red in color where you can get decent
Doses of lycopene.
On this slide I'm showing you a couple of those pink grapefruit, in one pink guava and the papaya, and especially watermelon. All of those are rich sources of lycopene, so it's important to think about getting those in your diet. If tomatoes aren't where you want to go,
to get that dose of lycopene.
so now let's cover some pro tips on how you can maximize the potential to get lycopene from tomatoes. First of all, don't worry about the tomatoes. Tomatoes have been stored or processed. Lopine holds up really well with respect to freezing, refrigerating, canning, etc. Next, we want to think about cooking those tomatoes rather than leaving them raw. Believe it or not, raw tomatoes is not your best source of lycopene. Lycopene is pretty tightly bound to the tomato pulp and the cell membranes, and cooking it will help release it and make more bioavailable. Plus lycopene is lipid soluble, so cooking in oil really doubles down on releasing that lopine and making it super digestible and super bioavailable. So you want to think about cooking those tomatoes in a heat stable, or like our avocado, like an olive oil or coconut oil, to release that lycopene and get it ready for digestion. And that's why tomato sauce tend to be really good source of lycopene from tomatoes. Alright, so what are our takeaways? Have numbers. 1, I hope I've convinced you that lycopene is super important to prostate health, and tomatoes in particular are a great way to get that lopine. Definitely want to start thinking about having tomatoes in the diet as often as you can remember. That just having tomato sauce is twice a week was a great way to significantly reduce your risk of prostate cancer and improve prostate health overall. But the more often you can get your tomatoes, the better off you'll be. And if you can't get your tomatoes as often as I'm recommending, think about getting lopine supplement. Most supplements have up to 40 to 60 mg of lycopene, and it only takes 14 milligrams a day to put you into the highest quartiles of lopines intake to get most of the benefits that we've discussed. And lastly, if you really want to replicate the power of medication and maximize the benefits of lopine with the highest doses trial, you want to go for the 500 milligram twice a day supplement, and I'll leave a link for that in your description. I hope you enjoyed the video. I will see you next time.